Doc shifter. Conversion done right.
So if we just take a typical document lifecycle, just a simple step-by-step, and again, there's obviously sort of variances of this kind of flow. But if you take sort of the initial content being authored by your medical writers or other authors of the content, using Word tech as well, kind of authoring it, reviewing, updating in Word, at various points in the life cycle, that document may well then be rendered or converted into PDF, which is obviously the beginning of preparing that content for inclusion in a submission. That PDF is often has to be prepared, though, however, because often the raw rendition, the raw PDF file, isn't really ready yet to share with the health authority. There's other technical elements and bookmarks, etc., that need to be incorporated. So that PDF has to be prepared before it gets included in the dossier itself or dossiers. There's typically then a draft published done, at which point you can begin validating not only the submission, but the individual documents potentially as well, the components of the dossier as well, to make sure they comply with the different health authority requirements. Obviously, the problem becomes a little bit larger when multiple health authorities are involved. You may have the same content obviously being included in the same submission for multiple health authorities. So again, the beginning steps are similar, the author reviewing, updating in Word, kind of getting converted into PDF. But that PDF then has to be prepared for potentially multiple health authorities with slightly different technical requirements on the PDF. They may be 90% the same. There are typically some variances between different health authorities as well. So you have to prepare multiple PDFs, even though the source document is the same. Those multiple PDFs are then incorporated into your different submissions, draft published, validated, etc. as well. So obviously the problem becomes exponentially larger the more health authorities that are involved.